Hey y'all, let's do a chemical peel, shall we? Now, let me first say this, okay? This is not medical advice. I'm a plastic surgeon. I am licensed. I would never do this to a patient like in my own home, but I'm right. So let's just get that out of there. Okay, so there's a two-step chemical peel. It's called the aluminized peel. And so it kind of starts off with the strong ethyl alcohol solution that's just really going to clean my face and make sure I don't have any residual debris on it. And then it's going to be followed up with this aluminized solution, which is basically concentrated, high concentrated salicylic acid, as well as mandelic acid, malic acid. So I'm going to explain like chemical peels and like why they're useful and things like that. There's different things to understand, and this chemical peel is also safe, for darker skin. One thing I want to do more of is just kind of educate on what's safe for darker skin and what you should look out for. Like, make sure that wherever you're going is safe and comfortable treating your skin, because you can have some damage to your skin. There was a time where I was told basically like this laser was safe. It's a very long time ago. For hair removal, I did it and my skin burned, y'all. So again, I've been there, done that. Just make sure it's safe. Make sure you do your homework. Okay, so chemical peels. Why are they useful? So we have bonds in our skin, right? Our skin is the largest organ in our body. That's why I feel like it's so important to take care of it, right? We have to take care of our bodies, our skin. But there are chemical bonds between the cells that cause the skin to stay intact, like those layers, each layer of skin to stay intact, right? We got epidermis, dermis, subcutaneous tissue, right? Like we have multiple layers in it. That's what helps. And there's different layers in the dermis, right? We have the papillary dermis, the reticular dermis. And so keeping those layers intact, those bonds are. What a chemical peel does is actually break up those bonds so that skin basically we cause controlled damage in the skin, so that skin kind of peels off. And what happens is you stimulate new skin to form. Now, why is that important, and kind of why is that important in a chemical peel? Because the idea here is that we're trying to regenerate skin, get a more illuminated, even tone, help with acne, hyperpigmentation, fine lines, wrinkles, a glow, right? The other thing too I think is important is you have to break that up occasionally, because what happens, y'all, sorry, this stuff, alcohol has a very strong smell to it, but what happens over time too is when you're using skincare, if you're not doing like a facial or microneedling or something to make sure that you're occasionally resurfacing your skin or getting rid of that top layer so a new layer comes in, you just pile on products, and sometimes the products aren't even working or absorbing and you're wondering why, so now this peel is a moderate peel. So peels are defined by what layer of the skin they penetrate, right? So this is a moderate peel. A mild peel will be like an alpha hydroxy acid, and that only is going to be the very superficial layer, the epidermis. Now I'm doing a moderate peel that's going to be more, it's going to get a little bit of the dermis as well. And now if you do a really deep peel, which those peels I would be really cautious with, especially if you have darker skin, but those peels are basically going to be a little bit deeper, right? And so that's the different how we define peels, right? So really mild, moderate, deep. So this is moderate. This is salicylic acid. Concentrated salicylic acid also has mandelic and malic acid. Now, what does that mean? So basically, the different acids are different types of acids that penetrate at different levels, right? So the malic and mandelic acid are both alpha hydroxy acids. Okay, so what does that mean? Alpha hydroxy acid is an acid that is basically water soluble. So what that means is it can't go past, if you look at a picture of a cell membrane, it looks like little beads in a string. And those beads are what we call hydrophobic. In other words, they don't like water. So if something likes water, it's not going to penetrate, but it's going to stay in that superficial layer and not get past. And sometimes we like that. That's like glycolic acid that I use, about every 3 times a week. But anyway, that's good because it's going to stay in the epidermis and work in the epidermis and really clear out those cells, resurface get cells in the epidermis. Now, the salicylic acid in this solution is going to be a beta hydroxy acid, right? So it loves oil. It does not like water, so it's going to penetrate deeper into the dermis to really treat what we call desmosomes, skin attachments, break up those attachments, help with acne, pigmentation, things like that. My skin is doing okay. I have some hyperpigmentation here. I've been having a little bit of breakouts, so sometimes I do this to reset my skin. And I try to do this once every 3 months, but it's probably been 6 months since I've done a chemical peel, so I'm a little bit behind, but these are different treatments I do, like I call maintenance treatments, just to kind of keep my skin up and keep it refreshed. Now, this peel I'm doing, so this is the peel solution. what I put on was like ethyl alcohol to just clear my skin, make sure that all the debris and dirt is out, and that was so. And I washed my face, so that tells you like how much debris and things we keep on our skin on just a regular basis. That's so important to get clean. But anyway, this is the peeling solution, which is salicylic acid and the other acids I talked about. And it kind of burns a little bit, but it's not bad. Obviously, like I'm tolerating it fine. So what I do, what I'm gonna do, is just do several passes, just to make sure that I'm really applying this to my skin. You can see that there. Now it kind of tingles a little bit, and that's how I know it's working. But it tingles. I got a little tingle. I like a good tingle, y'all. So I'm gonna continue. So what I do is I continue until all. So I might get, I'll probably get a good two to three passes out of this. So this is my final pass. So what I do now, it's evening time. I'm just gonna let this be and rest. Now, this peel, sometimes I'll peel. In other words, like the superficial layer of my skin will peel, and I'll just kind of let it be. Sometimes I don't. Just depends. But this evening, what I'm gonna do for my skincare is just see how my skin feels. If I feel like it's dry, I might put on my Restore cream. But otherwise, I'll resume my skincare tomorrow. And what I'm going to do basically is I'm going to do a gentle cleanser and Restore cream. And I do that for like a few days just until my skin feels like it's ready for some of the harsher things. So you want to avoid like retinols, acids, and things like that immediately after a peel. Sometimes just not having the right instructions after a peel causes problems after. So you just got to make sure you are where the folks know what they're doing. Again, y'all, do not do this at home. All right, all done. All right, y'all, immediately after my chemical peel,